tell me what your name is.
Milo Thurber.
And Dr. Milo Thurber, where do you practice?
Kennewick, Washington.
So in Kennewick, Washington, you've been there for how long?
4 years.
4 years. And
Yeah.
how long have you been a 5-star management client?
All 4 years.
So you came out and you picked up a practice, and you came from an associateship before.
Yes.
Okay. And I think you learned a lot in that associateship, am I correct?
Yep, I did, for sure.
And so you had a great practice, and just recently some changes have happened. You've done 2 things. One is hire an associate.
Yes.
So tell me about that, and how's that going?
So it's going great. I ended up finding him pretty close to home, so it was easy for him to make the transition into our office. There was no moving he had to do, so that was easy on that part. He was a pretty hungry young guy waiting to kind of strike on his own, so he was excited to come into our office.
Did we help you with the selection process?
Yeah, I used all the 5-star interview process and used the samples for all the questions to ask and just followed it and checked off all the boxes.
Now, you sent me a text message with a picture of you and your wife on a vacation, and it was so cute, and I really liked it because it was a little bit of a joke. So can you tell the people watching this video what that text said?
Yeah, so my wife and I were sitting on a cruise ship. We were taking our family on vacation. This was before Christmas, so we were sitting on a cruise ship, and I sent you a text, a picture of us hanging our feet over the edge or whatever it was.
Right.
Just kind of rubbing in the fact that we hired this associate, and they're covering the office, and we were one new patient away from setting the record while we were gone.
So you're actually gone out of the office, and while you are gone, because you picked the right associate and brought him up right and did it according to 5-star procedures, he's in the office. And you guys almost set one patient away from a new patient record for a week.
Yes, yep.
And so now, let me ask you, what was your staff's response to having you gone? I mean, when the main guy's away, that can be pretty rough.
They were very excited that I was not there.
And so I think that you told me that it kind of hurt your feelings because they didn't even miss you, right?
Yeah, they didn't miss me too much.
Well, that's great. So how did your associate feel about being the guy who was the pilot in command, the guy in charge in your absence?
He's been on fire ever since that. Just really excited to be a part of the clinic and ready to set his own goals and hit his own milestones.
Now, just recently you mentioned that, in fact, just a couple minutes ago, it's the reason I pulled the camera out. I wanted to get you to talk about this. You're going on another vacation.
Yeah, another trip planned. It's in a couple weeks for spring break. We get to take my wife's parents to Iceland, so.
Oh, isn't that great?
Yeah.
There's so many doctors, and I don't know what your experience was like the 4 years prior to that, but they never got out of the clinic at all for more than a 2 or 3 day weekend, maybe a 4-day weekend, maybe. And now you're able to take vacations with the confidence that your associate can not only cover for you, but the staff doesn't even miss you, right?
I think they're looking forward to it. I don't know.
Now, you did another thing, and you mentioned it just a couple minutes ago in the seminar where we're at right now, at 5-star, that you also joined the New Patient Academy, and you just shared something with the room. I heard some people gasp. What's happened with the New Patient Academy?
Well, we were in the MPA for a long time before we actually hired a COA, but this...
So you didn't do anything with the program, but you were...
I just locked it up and made sure it was mine.
Okay.
I think that was about a year of that, but we did hire a COA 4 months ago, and 3 out of the 4 months we added 50 new patients that came into the clinic and received treatment.
So 50 new patients that not only came into the clinic, but also started some type of care.
Yeah, and that was each month.
And that's each month.
Yeah.
And so that's responsible for your practice growing, your associate's practice growing, in fact, the whole clinic growing, right?
Yeah, yep.
So, I mean, so here's the question, and I want to ask you about 2 things. If somebody's thinking about hiring an associate, they want the extra help, they want the extra freedom, they want the extra money, what would you tell them about the 5-star management plan?
Just follow it, letter by letter.
Do it.
Just do it.
That's great. That's great advice. And if somebody wanted extra new patients so that they could build their associates and their own practice, and they're thinking, I wonder if I should do the New Patient Academy, what would you tell them?
Same thing, just do it. It really is a cookie cutter approach. You just put it in place, monitor it, and it kind of runs itself.
So now you can get some pretty big ideas as a result of having your associate work out so well, number one. Number two, having all the new patients. I mean, do you see yourself at some point in time having a couple different associates?
Yeah, in fact, I've put that in one of my goals just recently, was to add another associate.
I mean, if somebody's profitable right away, and I think you took your guy just a couple months in order to get into profit and make you more money than he was actually costing you, why wouldn't you want 2 or 3 of those, right?
It'd make a lot, would make a lot of sense to do that.
Okay. Well, I really think that your success is wonderful. I'm thrilled for you. It couldn't happen to a nicer guy. And I want to congratulate you.
Well, thank you, and I'll appreciate your help.
You're welcome.